I think one of the clear ways that we alter therapy is the thinking about the stem cell transplant. Is it appropriate to use a stem cell transplant and in what timing? And who is the donor? So obviously you don't want to use a sibling who carries the same mutation, because we've had very clear examples of donor-derived leukemias or failure to engraft because those stem cells already have an abnormal hematopoiesis at baseline. So that's absolutely the first clinical step. That's very critical. Even if you have a family where we can't identify the mutation, sometimes we already alter what we're doing for a stem cell transplant because the family history is so clear. Other times we can really start to understand what are the other organs that could be affected, and that impacts how they're going to do with different therapies. And so we then can monitor for infectious diseases, or some telomere disorders have pulmonary and other organ sensitivity to specific therapies and transplant regimens, and so knowing about them can help your patient avoid significant morbidity. When we identify a known mutation or a family history that's really striking where we can't yet identify what it's from, all of the patients in the family, usually they're the ones who can bring it to your attention. I'm worried about being at risk for MDS and leukemia because I see my family members dealing with this. And so what should I do? And right now we're sort of limited in our tools. We monitor with blood counts. We could monitor with sequencing, but we don't know what to do with some of those mutations, like Dr. Behar was mentioning with his studies. And so right now a lot of that is on a research basis where we're trying to understand what are the biomarkers that we can actually follow that will predict when someone is actually going to develop MDS and leukemia. Because many patients actually live their whole life carrying one of these mutations and never developing disease. So we would hate to intervene on somebody who won't ever develop leukemia.